Minutes matter when it comes to saving a life, and UPMC is leading the way on teaching the public about health life-saving initiatives that anyone can learn. One of those we're discussing right now, and that is how to administer Narcan. We are very fortunate to be joined by Dr. Adam Barnathan, toxicologist with UPMC, and Teresa Sellers for UPMC Center for Addiction Recovery. Thank you both so much for talking with us about Narcan administration. For people who are unaware, let's just start with the general overview. What is Narcan? So
Narcan is a very interesting medication. It is used for the reversal of opioid overdoses. What it does is it antagonizes what's called the mu receptor, which is what causes the respiratory depression and ultimately death in overdoses. Really, 2 sprays of Narcan can save a life.
So all you do, and I know we're going to show people how to actually do that, but if someone is overdosing, in the most simplistic terms, you give them 2 sprays and it saves their life.
Well, I would say when somebody's overdosing, what you're going to see at the scene, which is the most important thing, is you're going to see somebody down, either slumped over in a chair, or you're going to see somebody on the floor. The first thing, of course, is scene safety, like anything. Make sure that you're safe. Call 911. The next thing you're going to do is hopefully have Narcan on you because you've obtained it through the resources that were provided, and you're going to arrive and check the patient's breathing. If you see they're breathing and they're responsive, they don't need Narcan. Now, if they're not breathing and you don't detect a pulse, go ahead and give that Narcan right away. It will work almost immediately. You will see almost an immediate response if it is an opioid overdose. You'll see that unconscious person become conscious, and you'll kind of know at that point that what you've done has worked, and you'll just accompany the person until EMS arrives.
All right, Teresa, what if it's not an opioid-related overdose?
Then you've already hopefully contacted 911, and you just, again, always keep in mind scene safety and just stay with the patient. If you know basic life-saving measures, of course, proceed with that, CPR, but stay with them and keep a close eye on them, because they may then, while you're waiting for 911, they may stop breathing, even though when you first approached them, they were breathing. So you just have to really be keen on observing them and knowing which way to go.
Dr. Barnathan, this has recently been one of the more active and, for that matter, deadly times in recent memory when it comes to overdoses. What are you seeing in the hospitals? We heard the segment ago about what police officers and the coroner are seeing out in the field. What are you seeing in the hospitals?
So it's a great question, because I'm seeing it from 2 aspects. I'm seeing it from the emergency department, and I'm seeing it in our clinics. And really some history of kind of this epidemic would really help to understand what we're seeing. So about 10 years ago, it was predominantly heroin in our drug supply. Now heroin is almost undetectable in the drug supply. What we have instead is we have fentanyl and fentanyl analogs. And these are hundreds of times more potent than heroin. And the reality is people just don't know what they're getting. So what we're seeing is a lot of unintentional overdoses where somebody either was recently incarcerated or recently sober and hasn't realized that the world around them has changed. And when they go to use what they typically would use, they find themselves, if they're lucky, in the hospital, unfortunately far too often at the coroner's office.
So we want to be able to show people just how easy, for that matter, it is to administer Narcan. So, Doctor, you are going to, would you like to do the example in the seated position first with Ms. Sellers, or would you like to lay on the table? Because we're going to do both examples.
Sure. So if you want to just be seated, and this is really what you'll see. And I should mention that most overdoses actually happen in the company of someone else. So it's going to be a friend. It's going to be somebody who might use. This is what you're going to see. It might be a family member, and you're going to check scene safety. You're home, so you know it's safe. You're going to have an idea of what's going on, and this is the box it comes in. So this is what you get when you go to the health department and you get your resources. It comes in a 2-pack.
And right now, all I'm seeing is Teresa slumped over, lifeless body. This is what you're looking for, this type of reaction.
There's only so many interventions we could do as just bystanders from an emergency medicine standpoint. When we see somebody unresponsive, this is the number one thing we could do aside from checking a pulse and starting CPR. So this is what you might see. So I'm going to check a pulse, check to see if she's awake. Teresa, no pulse, not breathing. I'm going to open up a Narcan kit, which looks like this. And this is like called an atomizer. And you're just going to lift the chin, close the nose, and plunge down. That simple. Now you have a 2-pack, so if in 5 minutes you don't get a response, go ahead and give another one.
Important to note, 5 minutes in between sprays.
5 minutes.
That has to be the longest 5 minutes of anyone's life.
Well, I should mention that if you do not have a pulse after giving Narcan, go ahead and start CPR as you would in any other situation.
So if we're breaking this down, first thing you do, call 911. Get someone on the scene immediately. Second, you're giving that first spray of Narcan. Third, you are performing CPR or other life-saving measures to buy you some time. And 4, after 5 minutes, you're going to do what you were about to do, which is give a second spray.
It's that simple. It really is. And the reality is most people who have Narcan in the house, it's because they have a family member who uses or they have a friend who uses, and they're going to know. They're going to know because they're going to see constricted pupils. They're going to have seen this before, and they're going to really hope that they have some Narcan in their hand because this will save a life in that situation, and generally it will save somebody who's in their 20s to their 50s.
How long, if someone's unresponsive, 5 minutes seems like if they're not back after 5 minutes, I feel like, and again, I'm very naive and ignorant when it comes to this stuff, which is why I'm asking you. I feel like after 5 minutes, you're dead. So
the real world answer is nobody keeps a clock in these situations. 5 minutes is not really, you're not setting a timer. And the real answer is you're probably going to have some idea that this person overdosed because you're probably going to know the person's history.
Got it.
And you're going to go ahead and you're probably going to open up that second pack in 2 minutes, and that's okay.
All right, so we're saving that pack because we're going to show the other way. So in the event that someone is passed out on the ground, in this case, we're going to use this table. Dr. Barnathan, if you could kind of assume the position, and Teresa, you're going to be the one to administer the Narcan in this situation.
My leverage here.
Okay, so you're out in the neighborhood, you don't necessarily know the person, and you're going to approach them. Again, scene safety is so important. So you kind of check the area. Sir, are you okay? Okay. Pulse. Unresponsive. Pulse. And again, you take your atomizer, close the one side, and spray.
Important to know, because I'm repeating this because you've now said it, and Dr. Barnathan said it multiple times. Close the one side of the nose, and then spray the other side.
And then spray the other side, yes. And you should see immediate, if it is an overdose, immediate reaction that they're awake.
Got it. And it's that simple. I mean, I hate to make this seem kind of small, but it is that simple, and that action will help save someone's life immediately.
Right. And that is minutes, and that's why we're here. Minutes matter. Yeah.
For people, we talked earlier about how there is a limited supply of Narcan available at the Harrisburg Police Bureau. Where can people, when that supply runs out, because nothing is infinite, where can people go to get Narcan nowadays?
Pharmacies have it. They will run it through insurance, or there are different groups, like I heard Kristen say earlier, JFT or the RAISE Project. There are places around the community that have available resources.
Can naloxone be used the other way for someone that is looking to get high? Can it be used in that way at all, or is it strictly a life-saving substance?
Life-saving.
Got it. Okay. All right. Just, doctor, if you want to kind of come up.
Oh, yeah.
Well, welcome back to life.
Thank you. I also want to bring up from the hospital point of view, if that's okay with you.
Yeah, absolutely.
Our ERs are the first point of contact for a lot of these patients. Not the clinic. The clinic is a great resource, but a lot of these patients that overdose, our first point of contact with them is in the emergency department. And what I always hear patients tell me, and this is true especially at UPMC facilities, is I didn't know that there was help available. And I say, of course there's help available. We have an addiction medicine service here at UPMC Harrisburg. We have addiction medicine resources. We have a clinic. And they're shocked because that is not the general experience they've had at other hospitals. So when we see them and we resuscitate them with Narcan, the first thing we talk about is treatment. And shockingly to other people who aren't in the field, these patients do really, really well when they're engaged with addiction medicine early on.
And that's where the Center for Addiction Recovery comes into play. Where can people go for more information on the center?
The UPMC website, it's UPMC Center for Addiction Recovery, and the phone number is 717-782-4781.
And we're including that number with the number for Dauphin County Drug and Alcohol Services, and also the number 1-800-662-HELP, H-E-L-P. Dr. Barnathan, Teresa Sellers from UPMC, thank you so much for joining us to shed your expertise on why minutes matter when it comes to saving a life.
Thank you.